to the CONNECT Collaborator Interview Series, where we host 10-minute conversations with healthcare professionals and partners with the goal of encouraging deeper collaboration in the healthcare industry. Today's guest is Dr. Abby Collier, Executive Director of Prostate Cancer Foundation Canada. Abby joined Prostate Cancer Foundation Canada, or PCFC, from the University of British Columbia, where she was a professor of drug metabolism and pharmacokinetics. She previously has secured multi-million-dollar investments in research grants, equipment, and infrastructure that has been involved in policy advisories to governments in Canada and the USA. Dr. Collier was appointed when PFC became a national organization. Dr. Collier's experience and knowledge of academic, industry, and government aspects of drug discovery, development, and regulatory affairs underpins her work for PCFC, providing awareness, support, education, advocacy, and research in prostate cancer for men, their families, caregivers, and wider communities. Welcome, Abby, and thank you for joining us.
Oh, thanks, Lorie. It's good to see you.
Prostate Cancer Foundation Canada has two main pillars, education and advocacy. Could you share what makes the foundation's educational activities for patients, caregivers, and healthcare providers unique?
In terms of pillars, we have several, and you can reduce them to education and advocacy. But as you mentioned in your introduction, I think support and research are important as well, but they also come in under education. And I think our support network and our education for people that have prostate cancer, as well as early detection, is really important. We have 72 support groups across the country. Many of them are local, some of them work hybrid, and some of them are completely online as a national opportunity. We provide speakers that can be medically or scientifically qualified or work from their own lived experience. And I think those kind of educational components, including with support, really help people on their cancer journey, on their prostate cancer journey. Secondly, in terms of advocacy, we're aware that there's often a gap between new drugs and approvals. There's also often a gap between approvals and funding. And we believe that healthcare is a human right. And although our healthcare system is very stretched, we're here to make sure that prostate cancer patients are also considered part of the equation.
We know prostate cancer differs a little bit from other cancers due to its chronic nature and the way it's managed. Why is it important for patients and their caregivers and families to understand this unique aspect of the disease?
For prostate cancer specifically, it's commonly very slow growing, and unlike other cancers, for prostate cancer, there's often a watch and wait approach, also called active surveillance. And that means that you can be diagnosed as with a potential problem, but you can keep an eye on it. And it's not always an acutely urgent thing. So what we want is for people to be aware of this disease and to have good management with good medical advice, but also good social support as well.
Before you can go into the watch and wait, it's early detection, and we know it's vital for all cancers, but particularly prostate cancer. What strategies do you and the foundation recommend for early detection?
We know that most men, particularly over the age of 60, they have what we call prostatic hyperplasia. Their prostate grows anyway. It may not be cancerous, but it's growing. Keeping an eye on that and understanding that that's part of our aging process, but then also understanding when it becomes abnormal. And your healthcare provider, usually the doctors, the GPs, are the people that do that. They may send people for a PSA test, a prostate-specific antigen test. So this is a blood test that can monitor as your prostate gets bigger, it starts sending these proteins out into the blood. Unfortunately, it's not funded across all provinces, so that's part of our advocacy that people should not necessarily have to pay for this testing. And there are newer techniques coming through, including MRI, which is imaging, and certain types of other imaging technologies where you can look and see a picture of the prostate. And those are medical decisions that men make with their families, their carers, and their medical providers. So we suggest that, particularly as men age, they keep in contact with their general practitioner and that they consult with them as to how to detect these things early.
I know you mentioned at the beginning there's a lot more pillars, that Prostate Cancer Foundation Canada currently offers, and unique programs and services. Maybe before we get into those, could you tell us a little bit about a couple of the recent programs, the Reef Not Kid, and maybe your partnership with Hockey Fights Cancer? And then I'm going to follow up around your efforts around knowledge translation and research.
Our Reef Not kits are fairly unique to us. They contain books written by medical professionals. They contain dietary and exercise guides. We also pop in there a little information booklet that you can find your local support group or your national support group online, in person, by email and telephone. So the idea is that these get distributed not just by support groups, but through urologists' offices and general practitioners' offices, family care, so that there is something there and people can take it away and read it at their leisure. It's a physical kit. We'll post it out to individuals if they ask us for it, and we send it at no cost. We're working on making that also online so that people can access it remotely, but there's also a preference. Some people prefer to have something that they can hold on to. Secondly, Hockey Fights Cancer was something we were invited to this year for the first time. And we were so grateful to the Vancouver Canucks organisation and National Hockey League for asking us to take part. Primarily, it's an awareness campaign that people understand. And as you can imagine, with hockey, there's a lot of men that participate, and we feel like it's a great outreach into the community, which is meaningful to them. In the past, Hockey Fights Cancer has been primarily focused on breast cancer, and we're very, very grateful that for us it was the Canucks to start with, but also expanding across the country to the Flames, the Oilers, the Maple Leafs, all of these teams with partnership with the National Hockey League to really get to our men across Canada.
And maybe you could tell us a little bit more about some of the future things that are coming and efforts in knowledge translation and research grants.
For over 20 years, Prostate Cancer Foundation British Columbia has been supporting trainees, so graduate students, PhDs and masters, and then postdoctoral fellows. So that's extra training that you do after you've done a PhD. What we've recently done is this has become a national concern, and we're inviting people to send in their applications, and then we review them once a year, and for the talented and lucky people, we're able to hand those out. In terms of knowledge translation, a new sort of thing that we tried last year, and we've now codified it, we're doing it, is to support conferences. And whether these are small workshops, whether they're satellite conferences to a larger conference, as long as they're focused on prostate cancer, we believe that bringing people together and making conversations happen and allowing people to freely express ideas is the best way forward, and provides an opportunity to disseminate, even for those trainees that we support. Then they can go and discuss their research with more senior people, but also sometimes the more junior people have the best ideas, and we want to support that.
Looking forward, what are some of the things that you're excited about that Prostate Cancer Foundation Canada can maybe people can expect over the next few months, years?
I'm really hopeful, and I think the foundation is making more and more strides to support more and more men. We've recently put together a clinical and scientific advisory boards to strengthen our own selves, and that they can help guide us in the newest and best approaches, both research-wise and medical. We're really keen on keeping our support groups going. We had 69 up until December, we now have 72. That tells us that we're providing benefit and that we're providing support across the country at a grassroots level. And then thirdly, the idea that we've put together recently a speakers list, and that this contains medical experts, it contains scientific experts, and it contains lived experience with people. And we want to be able to get those ideas out there in a really safe and informative manner so that people feel supported and they feel knowledgeable.
Excellent. So thank you, Abby, for joining us. We wish you the best of luck with all of these activities, and it looks like you're on quite a great road. If you can let us know in our audience maybe where people can find more information and contact you.
Yes, absolutely. So our website has a huge amount of information on it. We are www.prostatecanada.ca. You can find the outreach details for emails for all of my staff. There's 5 of us in the office, small but mighty. And we will get back to you as soon as we can, usually within 24 to 48 hours. Please feel free. We take phone calls in the office as well. The numbers are on the website, or you can email us as well.
Excellent. Thanks, Abby.
Thank you kindly, Lorie.